performing hand hygiene. Hi, I'm Margaret. I'm going to be your nurse today. Can you please tell me your full name and date of birth?
Haley Pappas, June 19th, 2001.
Can I see your patient armband? Matches what she just told me, so it's the correct patient. I'm going to perform a focused assessment on you today. This exam will take between 5 and 8 minutes. I'm going to explain everything that I'm going to do. Just let me know if you're uncomfortable or have any questions.
Okay.
The patient understands the purpose of this exam. Before we begin, please empty your bladder if you haven't done that already. Here's a gown. The tie's in the back. Are you comfortable in this room with respect to warmth and privacy?
Yes.
Patient is comfortable and prepared for the exam and is comfortable within the surroundings. Okay, do you or your family members have any history of chronic illnesses, including diabetes, kidney failure, or high blood pressure?
No.
Have you had any chest pain, palpitations, or shortness of breath?
No.
And then do you have any swelling, pain, or skin changes, such as redness, warmth, or visible veins in your legs?
No.
If the patient had reported symptoms, I would further assess her pain using Old Cart's ice. The patient is at ease and relaxed. The breathing is quiet and unlabored. Her overall skin color is pink and appropriate for her ethnicity. I'm going to be checking your pulse in your head and neck to see how well your blood is flowing. Let me know if you experience any pain or discomfort. Patient's temporal and carotid pulses are equal bilaterally. I'm going to look at your arms and gently pinch your skin to test for hydration. The patient's arms are symmetrical in proportion to her body with no edema noted, and the skin turgor is elastic and she exhibits no tenting. I'm going to touch your arms with the backs of my hands and examine your fingers. Let me know if you experience any discomfort. Patient's arms are pink and warm. The capillary refill is less than 3 seconds. The nails are pink and at 160 degrees. I'm going to check your pulses at various points on your arms, starting with the brachial pulse. So if you could just put your palms up, and I'm going to feel right in here. Brachial pulses are equal, amplitude is 2+. I'm going to check your radial pulses. Okay, the radial pulses are equal with an amplitude of 2+. I'm going to look at your legs and examine them sort of the same way I did your arms. So let me know if you feel any discomfort. Patient's legs are symmetrical in proportion to her body. The skin is pink and warm. And then let me check your capillary refill. Less than 3 seconds. Now I'm going to palpate different pulses on your legs. Let me know if you feel any tenderness at all. Inside of your ankles. Okay, and then pop here. The popliteal, posterior tibial, and dorsal pedal pulses are all equal bilaterally with an amplitude of 2+. Now I'm going to examine your chest and focus on your heart. For the sake of her privacy, we're just going to assume that the chest is symmetrical with no abnormal findings or pulsations. I'm going to feel for your apical pulse and then listen with my stethoscope. Okay, the apical pulse is located at the fifth intercostal space at the midclavicular line. The pulse is 96 beats per minute and regular. I'm going to use my stethoscope to listen to your carotid artery. Please take a deep breath and hold it when I say go. Okay. Hold your breath. No bruise are heard over the carotid arteries. I'm going to use my stethoscope to listen to 5 different points on your chest, and I'm going to do that 2 times because I'm using the diaphragm and then the bell. Okay, then I'm going to use the bell. Okay, S2 is louder than S1 over the aortic and pulmonic valves. S1 is louder than S2 over the tricuspid and mitral valves. And then S1 and S2 are equal at Erb's point, and there are no murmurs present. You're all set.